The following portion of Health Matters is sponsored by Salina Regional.
Lindsborg Community Hospital is excited to now offer 2 imaging services to our community. The first is 3D digital mammography, which is the gold standard for early breast cancer detection and diagnosis.
And the second is a bone density machine, which can measure the density of bones and check to see if we need to treat for osteoporosis. My name is Amy Evans, and I am a registered technologist in radiology, CAT scan, and mammography.
And I'm Jody Miller, Director of Radiology at Lindsborg Community Hospital.
Well, ladies, thank you so much for joining me today. We're going to be talking about some services you offer down at Lindsborg Community Hospital. We're going to start out talking about mammogram, as I understand you've recently brought it back to the hospital. Why don't you just explain why that was an important decision?
Yes, we currently use United Radiology for mobile mammo services. However, our population, our need keeps growing, and so we have kind of outgrown our capacity with that service. It's important to us to provide access to that screening, so we've decided to bring that digital unit in-house. Digital mammography is the gold standard for breast cancer detection, early diagnosis. So that'll be a benefit both for our community and the surrounding communities.
So bone density is new to the hospital. What exactly is bone density and who is it intended for?
Well, bone density kind of goes hand in hand with women's health, though it does concern men also. Bone density is exactly what it says it is. It's just to check and see how dense your bones are, so we can determine if you're at risk for fracture. So basically we do the test and it shows us whether or not your bones are normal, osteopenia, which means they're starting to soften, or they're osteoporotic. So what the goal is to catch the disease before it progresses too far, so it can be, medication can be given and the bones can rebuild.
Let's talk about going back to mammography and talk about the importance of and when people need to have those done.
Well, mammography can start, it's recommended to start at 40 years old for women, and the reason it's so important for women to get started early is breast cancer is survivable, but you have to know that you have it. And we can actually detect breast cancer years before a woman can actually feel it or notices that she has symptoms. So early detection is the best medicine for this. If we can catch it, we can fight it.
Well, ladies, thank you so much for some great information and for coming on the show, and thank you for watching. For more information, you may visit lindsborghospital.org and like them on Facebook and Instagram.
More of Good Day Kansas after this.
The preceding portion of Health Matters is sponsored by Salina Regional.
It takes hard work, passion, and drive. It takes retraining your mind and your body. But once you do, you can't be stopped. Salina Regional Sports Medicine, here to get you back in the game.